Hello, I'm Andy Flemmer. I'm the CEO of Arkansas Valley Regional Medical Center. Nice to meet you, Attorney General Weiser. Looking out on this room, I see a lot of people I've met in the last year. Hard to believe it's been a year. So, a lot of challenges, but a lot of successes, a lot of rewarding experiences serving as the CEO of Rural Critical Access Regional Medical Center. For many, almost the last year, we were the only OB program between here and Garden City, Kansas. Lamar finally got theirs reopened, and I'm glad. That community needs an OB program within an hour's drive of most of their population. We were glad to stand in there and help them out while we could, but we're glad that it's back open. Our biggest challenge is lack of adequate funding. We're 42% Colorado Medicaid. Colorado Medicaid only covers 40 to 45% of the cost to care for those patients. What business can be sustainable when 42% of your business is only covered 45% of the costs? Add in the chase payments, that helps some, but there's still a gap. So that's our biggest challenge. So I see Kristen Carpenter in the audience, and Kristen's helping me find grants. So we're not just complaining about it, we're also lobbying. And I spent a couple days up under the Gold Dome in Denver with my other 46 colleagues, CEOs of rural hospitals across the state. And we had a lot of successes legislation-wise. So we're seeking grant funding to make up that gap. But we really need the state legislature to step up and appropriate enough funds to cover at least the cost of care for the Medicaid patients in this state. And we see also every mental health patient comes through our radar at some point, usually in the worst state of their crisis. And our team does an awesome job, and we work together with all their agency colleagues at Valleywide, and law enforcement, and throughout the county and the cities. So it's a great team here, and a lot of support and teamwork. So I'm grateful for that. My wife and I love it here.
Where did you come from?
Surprise, Arizona. We still have a home down there. I have family down there. And I was most recently in Seattle as an interim CEO of a 160-bed hospital. We're a big national company. Talk about a nightmare. 50-bed ER. With a line out the door, a 6-bed mental health unit embedded within it. It was always full. 160 beds, those were all full. I had a medical gas oxygen system that was so old we couldn't find parts for it. The company and the system that owned us would not replace it. So I was glad to get out of there.
Well, we're glad to have you here. I'll say a few things about the funding. We fought to protect, and thankfully did, the Medicaid expansion. It would be even worse if that hadn't. And we also worked with rural hospitals on a bill so that you could cooperate with one another to save costs, so that, again, the economics are a little less challenging than we know they are. So
thank you for the COPA bill.
No, happy to work with you on that.
And that's going to help all of the rural hospitals work together, where we were under threat of antitrust.
Their lawyers were scaring them, so we fixed it. Basically, they should be able to purchase goods through a buying consortium so they get a better deal. Just to give you one obvious example. Rick, who haven't we called on yet, Rick?
Well, I'm not sure, but I'm going to do a blatant plug real fast for Andy. Because I've been dealing with Andy for since he came, and he's done a great job. He's put this hospital financially stable. He's got his staff going great. He's trained them out and stuff, but he needs help. He talks about that. But what's one of the biggest problems? If you look at the stats of the people within Southeast Colorado, we're going to Pueblo Springs. Make this your first choice. Let's get our hospital back like it should be and what it was. And this man has done his part. We need to do our part. So every citizen out there, you look at Arkansas Valley Regional Medical Center before we go to Pueblo, okay? Let's start taking care of our own.
One gauge I use to judge whether we're having success there is we're getting a lot more compliments than complaints. Our quality scores have always been strong. We have great outcomes. And we're also getting surveying of our ER patients now to get facts out there that the patients are overall satisfied with their experience in the ER versus the negative naysayers that are got very loud voices out in the community. So I'm combating rumors with facts and data. And we always have room for improvement, and we know that. But we have a great team there, a lot of dedicated, experienced, long-term employees, and we're very fortunate to have such a wonderful medical center with so many talented, highly educated and trained and experienced healthcare providers. And I see the parking lot filling up more and more every day. And that's a great indicator. I know that sounds weird. I don't want anyone to have to be at the hospital, but if
better they're there than go to Pueblo.
please come to Arkansas Valley Regional Medical Center. We're there 24/7. Thank you.